Welcome to the Center for Health Affairs Board Education presentation, Northeast Ohio Hospitals, Our Economic Future. This presentation is based upon the Center for Health Affairs issue brief by the same title, which can be found on CHA's website, www.chanet.org. All issue briefs, as well as their corresponding PowerPoint presentations, are available on our website in the Publications section. This issue brief was originally released in August of 2006 and highlights Northeast Ohio's healthcare industry. While manufacturing was once the heart of the region's economy, the decline of that industry is necessitating a fresh look at our local resources and a new strategy for cultivating a robust economy. As the smoke from the smokestacks lifts, we are left with a clear view of our most promising enterprise, healthcare. There is no denying that Northeast Ohio has weathered some trying economic times. The picture of our economy over the last few years in many ways is not a rosy one. Job growth in Ohio has been below the national average for more than a decade. Cuyahoga County lost 9.3% of all local employment as over 75,000 jobs vanished between 2000 and 2005. Sales tax, another indicator of economic vitality, has not shown hopeful numbers either. Legislation that expanded the base of Ohio's sales tax spurred growth in sales taxes collected at the end of 2004 and the beginning of 2005, but aside from this, the level of sales tax collection has declined steadily since March 2001. While the manufacturing sector has been particularly hard hit by employment losses, there are some sectors of the local economy that are maintaining and even adding jobs. During the same time period, when manufacturing lost a quarter of its jobs, the region gained 7,700 hospital jobs, according to the U.S. Department of Labor, Bureau of Labor Statistics. This 16% increase in the number of hospital employees is attributable to increased demand for healthcare services. One way in which Northeast Ohio hospitals support the local economy is by attracting patients from outside the local area. In 2002, patients from outside the region accounted for 14% of area hospitals' patient days and 22%, or more than $1.1 billion, of inpatient billings. In addition, Northeast Ohio hospitals and research institutions attract significant federal research dollars. National Institute of Health grants are an important source of revenue that help our local institutions develop their national reputations as innovators and researchers, adding to the prestige of the region as a medical focal point. How do hospitals in Northeast Ohio compare to U.S. hospitals on measures of cost? An August 2005 report by the Government Accountability Office provides insight into how and why healthcare prices vary on geographic location. Despite the Midwest averaging the highest hospital and physician prices in the nation, Northeast Ohio hospital and physician prices did not follow this trend. The Cleveland-Lorain-Elyria region, which consists of Ashtabula, Cuyahoga, Geauga, Lake, Lorain, and Medina counties, ranked among the 25% of metropolitan areas with the lowest adjusted hospital and physician prices in the country. The outstanding quality of care delivered in Northeast Ohio hospitals is borne out by the data present on the Hospital Compare website. There were 19 measures for which the Center for Health Affairs member hospitals had data of sufficient sample size to warrant a rating for the period between June 2004 and July 2005. For a majority of the indicators, CHA member hospitals scored above the national average. In particular, hospitals in Northeast Ohio excelled in ratings of care for heart failure patients. Assessments of left ventricular function, or LVF, which check how the left chamber of the heart is pumping, are considered a crucial component of care for heart failure patients. While patients receive LVF assessments only 80% of the time at hospitals nationwide, Northeast Ohio hospitals provide this key assessment 94% of the time. With ample data demonstrating area hospitals' ability to provide high-quality care at a lower cost, what steps need to be taken to build upon the existing contribution that hospitals make to the local economy? One step is marketing and responding to consumers by continuing to grow and evolve physical facilities to meet consumer demands. Examples include single-person rooms and new equipment. Another step involves growing research and development. Already, Ohio has participated in part or in whole in 26% of all clinical trials in the U.S. This puts us in a positive position for growing this segment of the healthcare sector. A third step for hospitals would be to encourage business growth by using their combined purchasing power to grow existing business in the region and to convince medical device manufacturers to locate more plants here. It's of benefit, in fact it's essential, for us to begin finding new approaches to foster our local economy. And our hospitals, our most promising resource, are clearly where we should start. Few communities nationally or even internationally can boast the depth and quality of healthcare resources that we possess in Northeast Ohio. As we look to our economic future, our hospitals are bound to be our most valuable asset, and we must begin to create economic strategies that invest in and make the most of them. This concludes the Center for Health Affairs presentation, Northeast Ohio Hospitals, Our Economic Future. We hope you have found this information useful. Thank you.